Welcome to San Diego's most popular local morning news. Good morning, San Diego.
Doctors and emergency rooms across the country are getting ready for the increased number of people who may become infected with the virus. So what are local hospitals doing to protect patients and staff? This morning, David Davis joins us live from Rolando to explain. Hi, David.
Good morning, David.
Yeah, we're at Alvarado Hospital, and Dan and Sandra, and to answer your question, the hospitals are doing quite a bit to get ready for this. And in fact, I asked, are you sure that this thing's going to come back? And the answer was it never left. It is still here. It is still among us, that some people are still getting the flu and the H1N1, and I have my handy little face mask here just in case. But I'm talking with Dr. Arnold Kremer. He is a specialist here at Alvarado with H1N1. Good morning to you.
Good morning.
There are, I said something a moment ago. I said, yes, I'm still a little skeptical, still a little cynical about this H1N1. And you said, really, no, don't be, because it's a very serious thing. And like you said, it hasn't ever left us.
Well, it has never left us, and I don't think there's anything to panic about. But I mean, like any other disease process, we need to keep an eye on it, and if it is going to get more virulent, we need to be prepared. And we at Alvarado are prepared for anyone. If we get masses of people, we're prepared. We have isolation tents that will be set up. We have masks for everybody, and we're prepared for the worst and hoping for the best.
And this is something you guys talk about weekly. I mean, you keep updated on this.
We do. We have weekly meetings on the H1N1 with all the infectious disease experts, and planning strategy, enacting our strategy, and just practicing everything that we're going to do.
And in an emergency situation, as you mentioned, you will have tents set up and ready to go.
You bet, you bet. And hopefully that will not be necessary, but if it is, we're here.
All right, let's talk about the average person that comes in here and may have the H1N1. What are some of the precautions that you take here at the hospital?
Well, the first thing we do is give him a mask so we can isolate him. If possible, we isolate him in his own room and keep him away from other patients, because it's the one thing, you don't want to have to come to the emergency room for something different than a flu and go home with the flu. So we want to obviously avoid that. So we keep people isolated as much as possible. We have a hand washing program here. We teach all our employees how to wash their hands on a regular basis, and not only wash them, but then wash them with alcohol when they're finished, so that they don't spread it.
And obviously these masks are always available that we just showed.
Always, and so we give them to anybody we suspect of having it and keep them isolated, you bet.
All right, let's talk about the vaccine a little bit. We're being told that it's going to be at least the fall, October, possibly November, before the vaccine is ready. When it does come out, it's possible that there will be 2 shots given for this. And then on top of that, you have the regular flu. So we're talking about possibly 3 shots.
Well, yeah, it's a little indeterminate now what they're going to have to see how 1 shot does. It is possible they're going to need 2 shots. Could take anywhere from 2 to 5 weeks to develop immunity to it. But I believe the shots will be available. They said they have, I believe, 45 million shots already available. It was the last figure I heard. Don't quote me on that one. But and they will have even more very soon. So.
Now, again, let's talk. The regular flu, we're always talked about small children and the elderly. This one's a little different.
This one is different. The small children are very important. They are more susceptible. Anyone over the age of 60, 64 seems to be that number they've picked, are very immune to it. And there's very few cases, and even when they do get it, it's a little less severe than most people. But it's the kids, and the flu vaccine the first people that will get that will, number one, be health workers, but also those caring for kids 6 months and younger, because they are the most susceptible group.
Now, there are a lot of people out there that still feel, okay, I'm 20 to 45, 50 years old, and I'm healthy as a horse. Do they need a vaccine like this? What are your feelings?
They do. I think adolescents are also susceptible. Maybe not as much as infants, but they are susceptible. And you're seeing young kids who will get a bad flu more than the elderly. So I would say, yeah, you should get vaccine.
All right. And Alvarado, one more time, is ready for anything that happens.
We are ready, willing, and able.
Okay, Doctor, thank you so much for talking with us. And of course, all the hospitals around town are in similar shape that are doing the same thing for H1N1, but Alvarado Hospital here is ready, and as he says, they have weekly meetings on this to stay up to date on the vaccine that's being prepared and anything else that comes along. And we, of course, here at KUSI will be on top of the situation as we go through the flu season. I'll send it back to you, Sandra. Dan?
You're right about that, David, from everything from the schools and where people can get vaccinated to just the latest on when those shots are available. We're going to have it all right here at KUSI.
And the thing is, David, like what you said, you're like, some people are still skeptical about it, but the fact is, this is a reality. I mean, this is really happening.
That's right, and I got to say, I'm one of those that's skeptical. But after I've talked to the doctor here, not so much anymore. I think it may be in my future, a little vaccine action.
There you go. Just turned you around. David, thanks a lot.
Thanks, Dave.
See you later.
Yeah. Before we came here, we went to the hospital, Alvarado Hospital, and did some work on the H1N1 virus. We've been talking a lot about that as we head into the fall and the vaccine getting ready to be available to so many people. And we talked to a doctor there, an emergency room doctor, to give us an idea of how hospitals prepare for this and how prepared they are. And one of the things he says is, don't panic about it.
I don't think there's anything to panic about, but I mean, like any other disease process, we need to keep an eye on it, and if it is going to get more virulent, we need to be prepared. And we at Alvarado are prepared for anyone. If we get masses of people, we're prepared. We have isolation tents that will be set up. We have masks for everybody, and we're prepared for the worst and hoping for the best.
And this is something you guys talk about weekly. I mean, you keep updated. Well, once again, that's Alvarado Hospital and how they are prepared. They say they'll have emergency tents ready if it becomes an outbreak, hoping for the best, of course. But another thing that they talked about as far as the H1N1 virus is that it's not affecting, they have found since the first outbreaks, not affecting seniors over 64, 65 years old nearly as much as is affecting young people and even healthy people in their 20s and 30s. So something to keep in mind as that vaccine becomes available later this fall, October, possibly November. But we, of course, here at KUSI will stay on top of the situation throughout the fall and keep you updated with any new developments in the H1N1 virus and vaccine. Sandra and Dan, back to you.